Nothing pisses me off more in my job than finding out someone wasted years of their life in bad cognitive behavioral therapy. Hey, welcome back to the Psych Show. I'm Dr. Ali Mattu, clinical psychologist and cognitive behavioral therapist. I want to talk to you about that today, CBT, what it is, and how to know if you're getting bad CBT. CBT is one of the most effective treatments for things like anxiety, depression, bipolar depression, ADHD, and a whole number of other problems. It's about understanding yourself, your strengths and weaknesses, learning how to get unstuck with your thoughts, developing skills to help yourself manage difficult emotions, and also learn how to be in the kind of situations that you want to be in. While there are a lot of great CBT treatments out there and available with decades of research behind them, and there's a lot of people who know how to do these treatments, as a patient, as a client who's trying to navigate the mess of the mental health system, it's really hard to know if you're getting real good CBT. So in this video, I'm going to outline the top signs that you're getting bad CBT. Number one, therapy is mysterious. In CBT, the process is all supposed to be very transparent. What you're doing, why you're doing it, how the treatment works. It's kind of like a car. You can open up the hood and see all the parts and you know how this thing is working. If your therapy is mysterious, if you don't know why you're doing something, if the rationale hasn't been provided, if it doesn't make sense how the techniques being used are going to lead to the goals that you want, it might not be CBT. Speaking of goals, that gets my number two, which is your treatment has no goals. CBT is a very goal-oriented treatment. You have specific, observable, measurable goals, and you're able to know how your symptoms are doing, where you are in relation to the goal you're working on, and when you get to that goal, you kind of know that, okay, maybe it's time for us to start ramping down treatment. Not ramping down, tapering off. Tapering off. When it's time to start tapering off treatment. If your therapy doesn't really have any specific goals, if you don't know if you're making progress towards the thing that you came into treatment for, you might not be getting CBT. And it's okay to go into treatment and not necessarily have a goal. Sometimes that's what we do in CBT is we try to help develop goals. That's totally cool. But you kind of need to know what you're working on. And getting back to my first point, you kind of need to know how you're going to get there. The third way to know you're getting bad CBT is you're not developing new skills. This is one of the central things in all cognitive behavioral therapies, whether it's cognitive therapy or exposure therapy, acceptance and commitment therapy, dialectical behavior therapy. There's so many different types of cognitive behavioral therapies out there, but one thing they all have in common is developing new skills, new ways of dealing with your thoughts, new ways of dealing with your emotions, new ways to be in a situation. Number four is no homework. One of the things CBT might be infamous for is having homework, things that you have to do outside of your session with your therapist. The thing about therapy is it's great, but it's only for a small chunk of your week. Maybe it's 45-minute therapy, maybe 50-minute therapy, sometimes less than that. And it's not enough to help you take the gains you're making in your therapist's office and extend them to your life. Like, there's nothing we do in life that we can just practice for a little bit once a week and then we're done. Like, whether it's learning a new instrument, playing a sport, or any other skill you develop in life, you have to practice it. You have to do it over and over again. You have to do it outside in your real life. And that's where homework comes in CBT. A CBT therapist will often help you to learn something in session and then give you a specific homework assignment to practice that outside of the office. It's not to say you're going to have homework every single week, but CBT extends its reach outside of the office. And it usually does that through homework. The number 5 way to know you're not getting good CBT is you never get out of your chair or sofa or chaise lounge. Many CBT treatments will at some point get you moving in some way. They'll get you to practice something. They'll get you to act in some way. With a lot of my patients, when we work on anxiety, we leave my office and we go into the kind of situations that are difficult for them. Or maybe if I'm working with someone who has depression, we might practice a skill in my office. We might not leave the office, but we might kind of get up and do something. I should say, with some people I work with, we might do the whole treatment in the chair. Like, for example, if I'm working with someone who has generalized anxiety disorder and they struggle with worries and uncertainty, we might do all of that stuff in the chair, like help them develop skills right there in my office. So there are some exceptions here, but CBT is an active treatment. It gets you to do stuff. And if you're not doing stuff, you're not doing CBT. Have you been in CBT? Have you been in good CBT or bad CBT? What's your experience been? Let me know in the comments below. If you like this video, give it a thumbs up. If you want more videos that celebrate psychology and mental health, subscribe to this channel. And if you want more behind the scenes content, check out my Patreon where you can help me make more videos.